Now, you mentioned something earlier that, in the first year when you doubled, it was a lot more stressful than in the second year. Second year, it's like, okay, we got this down. We can basically push the gas pedal down as much as we want. So I'm curious, if you had to do it again, what was the main sort of things you learned in that first year that, now that it's like you could take over a practice and you wouldn't run into the same sort of pitfalls. What is the main problem that you ran into that first year?
Yeah, that's a good question. So the biggest issue was intentional leadership, spending the time to train, to teach the systems to everybody who came on, and first and foremost, formalizing and finalizing our onboarding process. Like, who do we hire and how do we get them up to speed? How do we make people feel supported right out of the gate? And what do they need to be successful? So we created, and this is what our clients use with our program. They're, first of all, how do you find the best people in the market for apposition? Now, if you're looking for a hygienist in today's market, I get it. If you get one, you hire them. And then you keep looking if it's not the right fit. But outside of that, like if you're looking for an admin person, let's say, you can find a really great admin team, no problem in any market. And we do this. We hire for people across North America all the time. If you find a great person who has the cognitive ability to do the job, which means they're going to learn it all, because dentistry is not exactly like a slow-paced environment. It's quick. It's kind of pressure pot at times. If you're sitting at the front desk as an example, it might be a lull in terms of people standing there, and all of a sudden there's 7 people waiting to check out, and the phone's ringing, and right. So it can be a little crazy, but if you have a person who can handle that, so you're not training and it's like going in one ear and not falling out the other, they have the capacity to handle that. They have the resilience, and we test all these things out with some assessments. They're capable of doing the job. Now we got to set this person up for success. How do we do that? Well, we have an onboarding process. We get them up to a minimum level of understanding of what do we expect here? What's our culture like? What does the rest of the team expect of you? These are things that you don't generally talk about in an interview or in an onboarding.
I've never heard a dentist talk about this stuff, and you bring such a good point. Like, we went through the same thing. It wasn't until we started asking these questions and thinking about who do we want to hire, what does this person look like, what qualities are we looking for, that we started to really scale. So I've never heard a dentist talk about that stuff, but it's so important.
You bring a weak mind into a stressful environment. I don't want to say, it doesn't sound right to say weak mind, but someone who's like, delicate flower, into a business that can be pressure pot at times, and they're going to fail. Like, it is what it is. When the dentist is producing $1,000 an hour, you can't have an assistant who's used to working with a dentist who's doing $200 an hour, unless they have the capability. And we've got to figure that out. There's no way to figure that out. You can either do it one of 2 ways. You can either put them in there and see what they've got after 3 months, or you can test that out before they start and figure it out, and then give yourself the best chance. So with the system that we use, we rule out those who are very unlikely to succeed. Then we've just got to make sure that they have a really smooth onboarding process. So we have a very clear, here's what you need to know. Here's all the boxes we need to check. So it's not training by osmosis where you put them in there and they try to watch other people do their job and they absorb some of it, but not all of it. Maybe they don't see this procedure for 6 months. No, I want them to learn it now. And I want them to learn it in a way where they can actually, go back and refer to this again. So we built an entire video training system. And now our clients use this process as well, so that it's super easy to bring in someone new in the clinical area. They don't have to spend 6 months to get to be any good. They can learn it within about a week and be very capable. And then it's systemizing things down so that, I give this example often, is there was a time when I was practicing that only one assistant was capable of setting up complex procedures because she was the only one who can get it right. Now we have a system that we've used for the last many, many years, and all of our clients use this system that is literally paint by numbers, color coded. You can't miss. The next person who walks down your sidewalk can set up any procedure in the office. As long as they are not colorblind, they can literally, it's literally like you can't miss. Every procedure has a color. You can't mess it up. And if you make it simple like that, so you take out a lot of the stress and thinking that people have to do, and you spend that time and energy with them building up the culture and the team energy. Like I said, leader influences the team energy of the team influences the patients. And then everything just happens much smoother. So if I were to go back and look at what did we do wrong, we did that part wrong. We just put people in a situation and we needed them to swim before we taught them how to swim. And the second time around, we did the exact opposite of that. And that is what totally changed the game for us. And it's the system that now we're using reproducibly with our clients.